So I'd like to introduce our final speaker, Dr. Catherine Ferrin, who is a paediatrics registrar from the London School of Paediatrics, making medical education great again.
Good morning. My name's Dr. Catherine Ferrin, and I'm a paediatric registrar in London and co-chair of the London School of Paediatrics Trainees Committee. I'm delighted to speak to you today about making medical education great again, my campaign to use trainee satisfaction data to identify targets for improvement in medical education. We are currently in a time of great turmoil amongst junior doctors. The 2023 Junior Doctor Survey by the GMC concluded that 23% of trainees are at high risk of burnout, with paediatrics ranking 7th most at risk. Improving trainee experience is essential to having a skilled workforce in the future and to ensuring safe and effective patient care. Key to this is listening to trainees about their experience and addressing what can be changed. The London School of Paediatrics has been running a trainee satisfaction survey for the past 10 years, gathering feedback from around 1,200 trainees across 32 trusts. We have an 88 to 90% completion rate and have used a consistent question bank for the past 5 years, which is specifically targeting key drivers of trainee satisfaction. While many groups survey their trainees, we believe that there is no point in collecting data if it is not then used to improve trainee experience. Our survey is unique in that it is totally transparent. The results are presented annually to trust representatives and college tutors, and then published on the school website where they can be accessed by any trainee within the school. We use the results to run excellence exchanges, where we visit high-scoring trusts and share their areas of achievement with trusts who score lower in the same specific areas. This allows us to share ideas across the region and leads to measurable improvements over time. We also find that peer collaboration and competition encourages placements to strive for excellence and work together to improve training. The survey itself is split into 3 sections and takes around 10 minutes to complete. Section A gives an overall score and compares to previous placements. Section B asks specific questions about areas which we have identified as being important to trainees. And Section C collects free text comments which are fed back directly to college tutors. Looking at overall satisfaction data over the past 10 years, we can see a gradual improvement in trainee happiness over time, with more trainees ranking their placements as good or excellent and fewer as poor. In order to sustain this trend, we sought to identify which factors have the greatest impact on overall trainee satisfaction to enable us to target these in lower scoring trusts. From our annual workshops following publication of the survey data, we've identified that the enablers of a good placement are supportive and enjoyable workplace with engaged consultants and high quality teaching. Placements score less well when there is poorly designed and understaffed rotas with limited learning opportunities on offer. Using the data from Section B of our survey, we were able to test which metrics had the greatest impact on trainees. We initially looked at placement rating by level and identified that ST1 and 5 trainees were less happy overall than their colleagues. It was suggested that this may be related to working predominantly in busy DGH hospitals with the associated staffing pressures and high workload. However, when we looked at the survey data in detail, we found that the overall score correlated most closely with the score for morale and workplace environment, especially amongst ST1s. Teaching was also important, but low staffing scores did not pull down the overall satisfaction rating. Having identified that some metrics are more important to trainees than others, we sought to quantify this. We carried out a time series trend analysis and derived associations between satisfaction and Section B metrics using multiple regression. This gave us a hierarchy of which factors are most important to trainees, ranking them according to which individual metrics have the greatest association with overall trainee score. Morale and an enjoyable workplace environment were the most important factors in influencing overall satisfaction score. Consultant presence and engagement was also key, and trainees naturally value their learning opportunities highly. Staffing ranks 8th out of 13, which again shows that while staffing can be a significant issue, it is not the primary factor in trainee happiness. Knowing that different training levels have different needs and priorities, we then reanalyse the data by level. As you can see, the highest ranking metrics remain the same. Core registrars place greater importance on teaching and rest facilities, while senior registrars appreciate opportunities to step up and lead clinical practice. Having identified what is important, the next step is to use this information to improve training. Our findings were again presented and published directly to trusts to demonstrate areas of consistency and targets for improvement. We also created a comparison table for all the trusts across London. We then ran workshops to collect specific examples of excellence in our key training areas, which can then be shared and adopted elsewhere. First, we looked at morale. Now, while this can often be dismissed as yoga classes or resilience training, what we identified is that what trainees want is time spent building team relationships outside of their clinical roles. Often this takes the form of shared meals or social events, but can be as simple as a post-ward round coffee break. Showing appreciation is also greatly valued with schemes such as Learning from Excellence and Greatix. Similarly, consultant presence is not solely in a clinical capacity. Trainees want their seniors to be more present at teaching and engaged with meetings such as junior-senior. In the post-COVID world, the increase in remote working has led to less face-to-face interaction between senior and junior colleagues, and this has led to a feeling of disengagement and separation between consultants and trainees. Valued learning opportunities are not only formal teaching sessions, but also identifying opportunities during the working day which can allow trainees to develop their skills. These can be tailored to training level and specific trainee needs, and then reinforced with lightning learning, debrief sessions, or supervised learning events. We were often told by trust leaders that staffing pressures make it impossible to improve training experience. However, our data shows that even trusts with very low staffing scores can still score highly overall if they have optimised the training and learning environment. The only way out of the current NHS staffing crisis is to improve retention, which is intrinsically linked to job satisfaction. Therefore, it is crucial to get the training experience right in order to safeguard the future of the NHS. It is clear that the work we have done is applicable not only to paediatrics, but to many different specialties across the country and outside of London. I hope that I've inspired you today to think about trainee satisfaction where you work and how it can be both measured and used. We're keen to share our learning to promote excellence in medical training across the country. Our evidence shows that by focusing on creating a supportive and enjoyable workplace with engaged consultants and a focus on learning, we can significantly raise trainee satisfaction, which will in turn lead to improved retention, better staffing, and a safer, more effective health service. In essence, making medical education and patient care great again. Thank you.
Thank you. That was 3 really interesting